So then let's discuss about this conventional treatment of cancer. First, surgical resection or surgery, and second, as a radiation therapy, and third, as chemotherapy. So these three are conventional therapy. We will go through one by one here. So the first one as a surgery. So here's an example. I put it as a laparoscopic surgery. So inside the abdomen, there's a lesion of cancer. We need to surgery. One way is open like abdomen surgery, which involves a lot more side effect. So nowadays, with technology, we use endoscopy with the tools so that we can have a less or minimally invasive surgery. So surgical treatment of cancer, which is just to cut the tumor out, and by surgical method, this is called a resection or tumor resection. By surgeon removes the tissue containing malignant cells or malignant tumor. This surgery depends quite a lot on the location and the stage of the cancer. So the location, if it's a skin cancer, it would be relatively easy for surgical resection. But if it's inside, deep inside the body, such as a pancreas, and the surgery will be more important because pancreas is right on the back of the stomach, and it involves major small intestine and liver, and those are like very close. It can be very difficult surgery. And also the stage of the cancer matters. So if it's early stage, we call tumor margin or surgical margin. If it's early stage, you may not need to take off a lot of the surroundings. But if the stage is higher, it's more highly infiltrative, then we have to take more of a margin, which contains mostly a normal, but because of the infiltrative nature, we may have to take a lot more tissue surrounding the tumor. So this example as a laparoscopic surgery when there's a tumor growing in the abdomen or pelvis. And for your example, laparo means a flank. So this is inside the flank looking at by endoscopy called a laparoscopy. And let's talk a little more of the surgery. So for example, in the there are many colon cancers. So let's say this part of the colon contains a cancer, then sometimes we decide not only like the tumor containing colon segment, the whole segment can cut it out and then reconnect the rest of the colon. So in this case, we can even do endoscopic surgery. So endoscopic surgery can be instead of whole opening the abdomen, we can use a minimally invasive surgery with the endoscope. Endoscope is a tool which can take pictures in real time, and also through its instrument channel, we can retrieve small pieces of tissue for biopsies or other analysis. So here comes an example of a colon endoscope. In this case, it's a flexible endoscope. You can see flexible shaft and flexible tip. And there are parts, because it has to navigate, there are parts to manipulate the direction of the tip. Also on the other side, there's a shaft which transmits the light source, air, and water for ligation, for irrigation. So, and some endoscope can be rigid. So here I put some different named endoscopy. It's good to know. For example, colonoscopy is for observing colon. Likewise, bronchoscopy want to look at the airways inside the lungs. And cystoscopy is looking at the bladder. And colposcopy, which came before, is looking at the cervix. And of course, laparoscope is looking into the abdomen and pelvis. And there are arthroscope, which is when there's a problem in the joint. So there's another kind of endoscope for looking at the joint, inside the joint, called arthroscopy.